A new study published in the JAMA Internal Medicine has identified that genetic testing could benefit women who do not currently qualify for it under breast cancer screening guidelines. Joining me now to discuss the findings is Lisa Madlensky. She is the director of the Family Cancer Genetics Program over at UCSD. Thank you so much for joining us.
Thanks for having me.
Thank you. For viewers who may not be familiar, what is genetic testing for breast cancer?
Sure. So probably about 2 to 3% of people are carrying a change in one of their genes that increases the chance that they'll develop breast cancer at some point in their lifetime. Genetic testing for this has been available for about 30 years, but it's typically been very restricted in terms of who can access it.
Why is that?
It started out years ago, and honestly, it's about 30 years going on now, when the technology was a lot more complicated, and so it was just a more difficult laboratory test. It cost more money to do. There have been such remarkable improvements in the technology that now it's easier, it's faster, it's cheaper to do.
This is a blood test too, right?
It can be blood or saliva. It doesn't even have to be blood anymore.
Okay.
Yeah.
And right now, who qualifies for genetic testing?
So generally people who know that they have family history of breast cancer at a young age.
So similar to those who qualify for mammograms, maybe?
A little bit different in that at a certain age, every woman is recommended to start breast screening just because breast cancer is so common.
Right.
Genetic testing, I think because these genes are relatively rare in the population, it's been fairly limited, sometimes by insurance companies, sometimes by health systems, thinking that, well, it's so rare, if we ask about family history, we'll be able to identify those few people that are carrying these genes.
Right. And then your new study, talk about the new study and how you said that the guidelines for genetic testing may be too narrow. What did you find overall from the latest study?
So this study, it's called the Wisdom Study. And the bigger purpose of the study was to figure out a smarter way to do breast cancer screening. Rather than one size fits all, can we find the highest risk people, start them earlier, do more screening, find the lowest risk people, and maybe back off of their screening a little bit. As part of that risk assessment, we did genetic testing on everyone, regardless of their family history, regardless of age. It was unrestricted. And we found that about 30% of people who ended up testing positive did not have any family history of breast cancer.
But the remaining did.
The remaining did. Yeah. So it's still a good indicator, but it is imperfect. And if you think about it, that kind of makes sense, right? Not everyone knows their detailed family medical history. Some people are adopted or conceived through donors. There's or just sometimes families don't talk about this stuff.
Right. And for those who do have the genetic mutation, they find that, what are the next steps then that they would take?
So there's a variety of things that could happen, right? It depends. There are some genes that increase the risk by a very high amount. There are other genes that maybe just knock the risk up by a moderate amount. So in some cases, we might recommend really intensive screening, maybe with mammograms and breast MRIs. In other cases, the genetic test doesn't end up really making that much of a difference, unless it's in the context of also having family history and other risk factors. So it can lead to a wide range of recommendations.
What were your thoughts? What were your thoughts concluding that 1 in 38 had this genetic mutation in the study?
Yeah, so that's the other important finding was these are women who did not have breast cancer themselves. And so finding that close to 1 in 40 people ended up with a positive test, and that about a third of those didn't have the traditional family history risk factors. If you put all of that together, it kind of implies that we need to do a little bit of a better, smarter job of thinking about how we offer this testing and who we offer it to.
And do you think that insurance companies would, I don't know, start to cover it, especially the more that these studies come out and proving that, that they do help and that in fact you don't have to necessarily have all that history, that you could carry that genetic mutation and not even know it?
Yeah, exactly. So at the end of the day, all of these decisions should be made based on data and science and research. And, so this is another piece of that puzzle. This is saying, here's current new data from, a population that's nationwide, and here's what we found. And so hopefully they do take that into consideration when they're making these policy decisions.
Doctor, thank you so much for joining us on this Monday. And again, more of that information you could likely find on CBS8.com, and you could revisit this whole interview later on our social media pages. Thank you so much. We'll be back after these messages.